A Breastfeeding Basic Production presents Sudden Infant Death Syndrome, also known as SIDS. SIDS is defined as the sudden death of an infant less than 1 year of age that cannot be explained after a thorough investigation is conducted, including a complete autopsy, examination of the death scene, and a review of the clinical history. SIDS is the leading cause of death among babies between 1 and 12 months of age. According to the CDC, about 1,500 infants died of SIDS in 2014. SIDS is a Breastfeeding Basic Production presents Sudden Infant Death Syndrome, also known as SIDS. SIDS is defined as the sudden death of an infant less than 1 year of age that cannot be explained after a thorough investigation is conducted, including a complete autopsy, examination of the death scene, and a review of the clinical history. SIDS is the leading cause of death among babies between 1 and 12 months of age. According to the CDC, about 1,500 infants died of SIDS in 2014. SIDS is a sudden and silent medical disorder that can happen to an infant who seems healthy. Between 1994 and 1999, when the Safe to Sleep campaign started, the overall SIDS rate in the United States dropped by more than 50%. However, the message about the importance of back sleeping is not reaching all communities. Research shows that among certain minority groups, about 1/3 of infants are still placed to sleep on their stomachs, a statistic that challenges the U.S. Healthy People 2020 objective of 76% of infants put on their backs to sleep. For this reason, the Safe to Sleep campaign continues its effort to ensure that messages about reducing the risk of sleep-related infant death and back sleeping reach every member of every community. Risk factors for SIDS include prone, side sleep position, maternal smoking during pregnancy, environmental tobacco smoke, overheating, soft sleep surfaces, late or no prenatal care, young maternal age, prematurity and or low birth weight, male sex, African American, and American Indian. Research on possible causes of SIDS include the triple risk model, which describes the convergence of 3 conditions that may lead to the death of an infant from SIDS. These 3 conditions are: 1. The baby's vulnerability is undetected, such as a possible brainstem abnormality. 2. The infant is in critical development period that can temporarily destabilize his or her systems, such as in the first 6 months of life. And 3rd, the infant is exposed to 1 or more outside stressors that he or she cannot overcome because of the first 2 factors. These outside stressors can be prone side sleeping position, smoke exposure, and overheating. Other possible research are the unseen brain abnormalities, genetic polymorphisms, and genetic mutations. The role as a nurse in preventing SIDS. Nurses as role models for parents. People learn best through observation, and research shows that parents are more likely to follow safe infant sleep practices, particularly placing infants in the supine sleep position when they see nursery staff consistently model this behavior in the hospital. The use of effective communication. Study shows that parents and patients are more likely to remember and follow instructions when a healthcare provider uses a positive tone, provides adequate and easy to understand information, and allows the patient to ask most of the questions. Encourage parents to take action. Parents should demonstrate the behavior that nurses have modeled in the hospital at least before discharge. Cultural sensitive advice. Infant care often has its roots in traditions and experience. It is important that nurses provide clear and culturally appropriate advice on reducing the risk of SIDS and other sleep-related causes of infant death. These are among the many safe sleeping practices that the nurse can advise the patient or the parents before discharge. Some of these safe sleeping practices are back to sleep for every sleep, no side sleeping, the use of a crib or bassinet that conforms to the safety standards, firm sleeping surfaces, no loose soft objects in the bed, room sharing without bed sharing, avoid overheating, and no sleeping and sitting devices such as car seats and swings. Additional intervention can also include promoting breastfeeding, regular prenatal care, avoid smoke exposure, alcohol, or drug use during pregnancy and after birth, immunization in accordance with the American Academy of Pediatrics, and supervise awake tummy time. This picture is a great example of a very unsafe environment. This puts this poor infant at high risk for SIDS.
According to the American Academy of Pediatrics, we're going to be going over the assessment for SIDS. Now, with baby crib safety, you're going to be having only one suction bulb syringe inside the crib at all times. You will also only have one blanket over the baby's abdomen. Next, you will make sure that there is no soft animal toys inside the crib with the infant. For the assessment of the baby in sudden infant death syndrome, the infant is apneic, which means it's a cessation of breathing for 20 seconds or longer. You will see that the baby is not having any respirations for that amount of time. This will need further investigation. The baby may also have some sort of color change. They could have sucralmoral cyanosis, which is a bluish coloring discoloration around the mouth. They can also have frothy blood-tinged fluid in the nose and mouth, shown here on the nose. Next, the infant can be found in any position such as this, but typically in a disheveled bed, with blankets over the head and huddled into the corner, as you see here. Next, the diaper may also be wet and full of stool, as shown here. And lastly, the infant may appear to be clutching the bed, also showing some type of sign of distress when they're clutching the bed.
Now on to the nursing diagnosis. Knowledge deficit related to risk factors associated with SIDS, enhanced parenting related to preventative measures associated with SIDS, grieving, compromised family coping, risk for spiritual distress. Here are some of the outcomes that we would like to achieve. Family members will seek appropriate support for assistance. Family members will use available support systems to assist in their coping and with fear management. Family members will identify feelings of hopelessness regarding the current situation. Family members will share feelings about the event to others. Family members will verbalize measures to prevent SIDS. Family members will use effective coping strategies to ease spiritual discomfort. Here are some of the interventions. Grief work facilitation, which we assist with the resolution of the loss, which is significant. We could also help them out with coping enhancement, which we assist the patient to adapt to the perceived stressors, changes, or threats that interfere with meeting life demands and roles. We could also help them learn anxiety reduction techniques to minimize apprehension. We could also use physical security enhancement, which we intensify patient's sense of physical and psychological safety. We could instill hope, facilitate the development of a positive outlook to the given situation, as well as emotional support, which we provision of reassurance, acceptance, and encouragement during times of stress, and finally, family process management, minimization of family process disruption effects. Now, on to the coping and support. We need to support the patient and as well as the entire family as a whole due to the loss of the child, which is devastating. We need to assure the parents that they are not at fault. And we also need to pay close attention to siblings' reaction. Most of the time, the focus is on the mother and father, but it could be very devastating to the siblings as well as the parents, and they could be left out in the shadows. We also should refer them to support groups such as First Candle. Thank you very much.